There is a common misconception about community hospitals, and that they tend to have poorer patient outcomes. When most of the time, a lot of people agree that the care they receive at community health centers tend to be better and more realistic than private hospitals. So, a lot of times people say they don't experience a lot of upselling for unnecessary procedures because they're not just a bottom line for community hospitals. In terms of healthcare quality, it is critical that the care delivered at such centers like community healthcare systems is evidence based, appropriate, well coordinated, safe, and patient centered. And through various resources and services administration and other federal private sector, state and community efforts and partnerships, community health centers have made major advances in adopting evidence based practices, improving patient safety, and meeting national accreditation standards, including the establishment of health centers as patient centered medical homes, and increasing the coordination, integration, in management of health center care. Um, this is really interesting because a lot of times when people think of like publicly funded or even government assisted items, they tend to think that it's a lesser quality. Where I think this is one of the few examples that the issue is not the quality of care that is received, but unfortunately, it's the fact that a lot of people don't still have access to healthcare because of certain socioeconomic issues. Even though racial and ethnic insurance coverage disparities are less prevalent at like community hospitals than at other like primary care providers or even private hospitals, more efforts do need to be focused on assisting those without insurance in applying for benefits and focusing on the reasons why a lot of people either can't get insurance or just don't have the means to do so. Although community health centers were founded to help support minorities, the socioeconomic factors like education, income, and equity limit access to insurance benefits, thus affecting health outcomes for patients in Los Angeles County community healthcare settings. And what was really surprising, especially to me in our research, was that 84% of all hospitals in the United States are community hospitals. And unfortunately, the community healthcare patient population itself is often sicker and more at risk than overall patient population seen nationally. And these are the people that are most vulnerable, and these are the people that public administrators need to find better ways to help serve this population, especially because these people are still being affected by socioeconomic factors that don't pertain to a lot of other people getting health insurance.